You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hi, you guys. I am so excited about today's episode. I have another incredible professional to interview today. Not only do I have a professional connection with this guest, but I also have a really beautiful personal connection that I am honored to share with you all. Today, we are interviewing Dr. Cassie McGuire. And just to give you a little bit of introduction, Dr. Cassie has been serving families for over 9 years. She loves all things relating to holistic health. Every time I sit down with this lady, I learn something new. She is full of knowledge. She is always learning so that she can help better serve, which she does, her patients and community. She has extensive training and studies in the Gonstead method of chiropractic. She has postgraduate studies in pediatric and pregnancy care, including the Webster Technique for pregnant women. And she also has completed a certificate in Craniosacral Training and Brava. And so we're going to kind of touch base on all of those things. She is a wealth of knowledge, and she provides so much amazing care, not only to How to Mom clients, but our community. And I am just so excited and grateful that you are here with us today, Dr. Cassie.
Thanks for having me, and thanks for the warm introduction. And I need to correct that on our website. It's actually over 11 years now. Wow.
11 years. See, I always, when I get introduced, I'm like, oh, no, my kids are 5 and 9 now. I do the same thing. Okay, 11 years. So even more knowledge.
Yes.
We have to keep up with all the things, right? So the personal connection that I have with Dr. Cassie was through meeting her at this networking meeting that she hosted years ago. Through that, we really connected based on our passions to help women through their pregnancy, birth, and postpartum journey. But since then, Dr. Cassie had her second son, and I was absolutely honored to support her as her birth doula. And I just feel like we have grown so close, not only on a personal level, but also through our passions in this professional world of pregnancy, birth, and postpartum. So if you are up for it, Cassie, I would love to get into some of the questions. I want you to tell us first just a little bit about your practice, but also your passion and why do you do this work?
Yes. Well, I, with chiropractic, I actually started chiropractic care at age 16 and was the last one in my family, believe it or not, because I was having headaches. So then I went in. And then in undergrad, I worked at a chiropractic office as well. But it wasn't until chiropractic school that I discovered the Gonstead method. And I just felt like it was so thorough and it really helped me. So then I dived deeper into learning that. And then I've had like probably 500 hours of extra extensive training in that method so that I can be better. And what we really focus on with the Gonstead method is really looking closely at the foundation, your sacrum, pelvis, making sure that's in alignment. We really like seeing the x-rays, but obviously we don't do that with pregnancy, but it's nice to have that beforehand because I can get an inside look at, how healthy that foundation, that structure is and the spine. And then I can get nice measurements on how to best adjust. But we have a lot of tools we can use besides x-rays so that we can be very specific on where we adjust a patient. And I really feel like Gonstead ties well in with pregnancy because we look so closely at that sacrum, that pelvis, that foundation area, and that low back. So then we can get really good results with patients. And we also use a nervoscope that finds where that nerve pressure is. So we're being very specific on where we adjust. So we're adjusting where it needs to be adjusted instead of just guessing.
Right.
So I find that very helpful too, and patients love that. And then we
Yeah.
also do nerve scans or thermal imaging to see where there's stress in the nerve system, which we can do on pregnant women as well.
Okay. Awesome. Gosh, a whole host of
Yes.
things that you guys are able to do. I want to be a little bit
Yes.
more specific. So, one area that you really love to focus on, and I think where a huge part of your passion comes from in your chiropractic work, is the pre and postpartum moms and kiddos that you treat. I would love to have you share some prenatal tips to women who are preparing for pregnancy and for birth.
Oh, yes. And another thing, too, even tying to that, is if you're pregnant looking for a chiropractor, it's good to look for a Webster certified
Yes.
chiropractor because they've had extra training working with pregnant women.
Yeah.
And there's a class, obviously, you have to go to for that.
Right.
And you can find that on the ICPA4kids.org. And most likely, those that are Webster certified have experience working with babies and kids as well.
Yeah, no, that's so important to mention, and obviously, that's something that I might take for granted just because we usually only work with, recommend chiropractors that are trained in Webster just because our clientele is usually during pregnancy. And so, yes, that's a huge valid point that we want to make sure that these pregnant mamas are treating with people who are specialized doctors in pregnancy.
Yes. And I also just took that Brava certification, which is very helpful with um, just understanding the core and the pelvic floor, and
Mhm.
then when to make the proper referrals so that each patient is getting the best care. So I found that
Right.
helpful too.
Yeah.
And I was just going to mention too, with my passion, I just love taking care of women and children, but really mostly women,
Mhm.
because women bring new life into this world, and I
Yes.
can't think of anything more vital than that. So I love to help support and encourage them through pregnancy and beyond, and especially with all those challenges that come, up in that postpartum phase. Usually we have so much support during pregnancy, but not so much during postpartum. And I think that's where, with you, with How to Mom, you have that great network of people and you encourage, you support women, and you do all the things, especially during that time, which we're often forgot about.
All right, you guys, we're just going to take a brief break so that I can tell you all about one of How to Mom's favorite go-to brands and products. Earth Mama Organics formulates and creates organic and natural herbal pregnancy, postpartum, breastfeeding, and baby care products. We believe that they are one of the best and the safest personal care products on the market for both you and for baby. You can follow the link in our bio, or you can go to howtomom.com/links. Follow the Earth Mama Organics link and enter How to Mom for your promotional code to receive 15% off. All right, now back to today's show. Yeah,
So
absolutely. And
back
I
to
think
tips.
no, but I think that is so important. And especially too, being a mom and going through birth and postpartum yourself, that only adds to our passion of knowing exactly what the needs are for these individuals. And
Yes.
yeah, it's so important that people are getting the care and the education that they deserve to understand kind of what's happening to their body.
Yes.
Can you talk a little bit about the Brava training? Because I love that of being able to really know when additional referrals are needed. How was that training?
Yeah, the training was great. And it's for birth workers. So, doulas can take
Yeah,
it. Different, practitioners can take that so they have more training.
yeah,
And um, it was basically the reason that Sarah Knight and Christine, who are
yeah.
pelvic floor therapists, started it was just to help fill the gap in knowledge
Mhm.
with all those birthing professionals, and um, just knowing when to make that referral,
Yeah.
especially with a lot of the issues with the understanding the core and the pelvic floor work, so we can
Yeah.
build that network more.
Yeah, so important.
Yes.
That's awesome. You are just such a wealth of knowledge. So, yeah, what are some tips for women who are preparing for pregnancy and birth?
Okay, the first couple things I usually always ask patients too is, have they thought about hiring a doula? Because you guys provide all that extra, emotional support, and you have a lot of education that you can, help them through the pregnancy and the birth process as well, and all those positions.
Mhm.
We can get more into that, but and then
Yeah.
also, do you do you have a pelvic floor therapist that you're seeing? But if it's your first pregnancy, probably not. So then I give those referrals. And then making sure that you're exercising safely. And there's
Mhm.
many different programs out there, and I can send you a list or share those with you,
Yeah.
like the more safe ones. Prenatal safe yoga, places like Luma do that.
Yes.
Making sure you're stretching. I show patients safe stretching techniques.
I think
A
that
good
is
one
something
is
that is so overlooked and we talk to clients about all the time. I'm like, just take
stretching. Yes.
5 to 10 minutes every morning and every night, to really kind of focus and just that soft stretching. It can be so vital.
Yes, the big thing with stretching too is opening up the those pec muscles in the front so we're not
Mhm.
rounding because we have all that extra weight in pregnancy
Yep.
that brings us forward, right? And then that makes that sciatic nerve flared up. So the stretching there, stretching out the glutes, doing squats, breathing in that squatting position too. And
Okay.
then another one that not only pregnant people can work on, but everyone is diaphragmatic breathing or box breathing.
Yep.
And I have a handout on that too. Go over that with every patient. But in pregnancy, the diaphragm gets pushed and squished towards the end.
Mhm.
So if you can start working on that early on, it's really going to help you relax
Mhm.
during labor in that birthing process. So that's a good
Absolutely.
one. And then you can
Absolutely.
do, and then prenatal safe massages, good nutrition, high quality supplements, making sure you're eating frequently if you have those blood sugar issues, space, getting more meals in if needed, and making sure you're getting enough protein and fats. A lot of us miss those healthy fats, which keep us full and give us energy. And just like your baby, they run mostly on fats. So
Right.
you're feeding that baby nutrition while you're taking in more of those healthy fats in yourself. So
Yeah,
that's important. And then
absolutely.
also with nausea, one thing I find is iron can sometimes cause that. So sometimes you may have to take like iron separately, not in your supplement if you're getting that nausea. Sometimes that can be linked to that.
Yeah.
I have a few more
Absolutely.
too. Got lots of tips here.
Yeah, no, you like I said many a times, like such a wealth of knowledge, and it's not just going into the chiropractor and being adjusted. It is a full comprehensive experience where a lot of
Yes,
these
lots of
women, their
things.
hands are being held and they're able to have so much guidance through their pregnancy. Can we talk a little bit
Yes.
more about what are some common pregnancy complaints that you see in your office? Obviously, we kind of already mentioned kind of sciatica and low back pain. I'm sure those are pretty
Yeah.
common. What are some additional complaints that you tend to hear in women who are carrying life?
Yes.
Mm.
So a lot of times you'll start to get more of those complaints pop up like second trimester, late trimester. So another reason why I say start early or even before pregnancy, because it's going to help reduce those complaints, especially further into your pregnancy. But another common one is round ligament pain, which is that
Yes.
pain in the front between the pelvis and that front of your pelvis bone. I
Yeah.
should say like that belly area on each side. So if you're trying to turn in bed, a lot of times you'll get like a sharp pain there.
Yes.
So that's where chiropractic can come in and work on balancing your sacrum, which balances the pelvis, which also helps that round ligament. And we can work directly on the round ligament, which is usually later, into that second trimester and third trimester, just to keep sure that it helps prevent that uterus from getting pulled on because it
Right.
connects to the pelvis, right?
Mhm.
So I always say, think of like a basketball hoop with the net hanging down, and
Yeah.
the baby goes through that rim area down into the hoop area. But if that's all twisted and tangled up, like the uterus, if those ligaments are tight, we can get that twisting and then they can't move in there right, or maybe they get stuck during the birthing process.
That's
It's a
a
good
really
visual.
great visual. How have I never heard about the basketball hoop? That's such a
I
great
love that one.
visual. Not only like the bony structure, but the muscles and the ligaments. That's so important. And so we talk a lot with
Yes.
our clients, and the reason why we refer clients for chiropractic care is kind of twofold, is what I explain to clients. It's first because we don't have to suffer through pregnancy. If we have these
Yes.
symptoms, there are ways to treat those symptoms so that we can enjoy pregnancy a little bit more. But also, chiropractic care really helps prepare the body for birth. And so I'd love to hear a little bit more
Yes.
specifically about how do these chiropractic treatments create more space for your baby to get in that optimal position for labor and delivery?
Yes. So, we have our chiropractic training. I've had GONSA training, but with the Webster method or Webster technique, what that does is you check that sacrum, and
Okay.
by adjusting that, if that's out of balance, there's things we check for, like the leg shorter on which side to adjust. That helps balance the pelvis. And the muscles and ligaments around that to
Mhm.
release tension on the ligaments and, of course, the uterus, because those ligaments from the uterus attach to the pelvis. And this allows more room for baby and then optimal neurodevelopment. So I have this, if you're showing this,
Oh,
it
yes.
moves, the pelvis
Yes.
and the sacrum moves. And if the sacrum gets stuck here, you can
Mhm.
kind of see how
Create
back
such a
labor.
narrow opening.
Yes. So we help keep that open so we can prevent things like back labor where the back of the head is on that
Sacrum.
tailbone area. It's
Yeah.
very painful. I had that with my first birth because I was traveling and sitting a lot. Not
Yeah, I
fun.
had that with my last, and it is definitely a different sensation, that's for sure. What I always find that
Yes.
so interesting, right, when we hear from a lot of clients or just from patients, I'm sure, about kind of, oh, there's no way, my previous baby could have fit through my pelvis. And yes, while there sometimes can
Hmm.
be engagement issues, that bony structure can move. And that's what's so
Yes.
beautiful about chiropractic care, is that you guys really keep
You
not
can
only
see.
yeah, it's flexible, exactly, it's meant
Yeah.
to move.
We also have the relaxin,
Mhm, hormone.
hormone. So we have that during, middle end of pregnancy, and that stays with us too, especially if you're breastfeeding more.
Mhm.
So another reason you get more loose during that time.
Yes,
So that's why you want to keep that in balance because it can be easier to go out of alignment when we have that.
it, like,
So
almost slips a little bit easier.
yeah, so that's why I usually try to stay in a maintenance schedule with patients or maybe see them a little more frequently at the end so that we make sure we're staying in balance going into that birth.
Yeah, and so, obviously, it's probably a case-by-case situation, but for the most part, what do you suggest to your patients at that end of pregnancy, kind of leading into the birth preparation and process? How often are you wanting them to treat?
Now, if it's a patient that's been coming in before
Yeah,
pregnancy or early pregnancy, usually we can do every other week. But coming into that last month, I usually do recommend weekly, just like you do your regular prenatal visits. Now,
yep.
sometimes we have people come in because they were confirmed from their midwife or their OBGYN that they're in a breech position or,
Mhm.
um, you know, basically the maybe their head
It's
back of
not
the head is
right.
back or not in the best position.
Yes,
So we have to see the baby a little more frequently. So it is a case by case basis and
yes.
more frequently if they're coming in like late term,
Right.
right?
And they haven't been getting care. Absolutely. So let's
Yes.
transition a little bit then to postpartum timeframe. What are some common
Mhm.
complaints that you see postpartum, and when do you advise that your patients come and see you after they've had their baby?
Yeah, I always recommend coming in once you feel you have that energy. A lot of times I say if you're doing okay, maybe wait till that 2-week point because I do recommend you staying home and not getting out of bed much during those
Right.
first 2 weeks because
Right.
you want to rest that pelvic floor so you don't have more issues later. So it's very important to rest. Just go to the bathroom and have that support at home if you can to help you with meals and snacks and all those things. But otherwise they come in usually, sometimes earlier, but around that 2-week mark.
Okay.
And a lot of times what I see too is if you're doing breastfeeding or bottle feeding or pumping, you're rounding forward,
Yes.
right? So we
So
get that
true.
mid back neck issue going on too. So we got to work on helping that out. That's the biggest thing I see in postpartum is the upper mid back neck.
Hey guys, it's Stephanie Sinclair, founder and owner of How To Mom. I'm just interrupting today's episode to make sure you are well aware of all that How To Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How To Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode. Yeah, absolutely. I remember that all too well.
Yes.
And then just to transition a little bit more, now all of a sudden we have baby. What are some common symptoms, or what should parents be looking for with their baby that they might need some chiropractic treatment as well? And I think it's important to, a lot of people are very fearful of chiropractic care with their newborn. Just through my own personal experience, it is extremely non-invasive, soft, nurturing. It is not a scary situation. But I think a lot of people that haven't experienced that firsthand, they have this like big fear factor. If you want to just explain a little bit about what should we be looking for as parents with our newborn, when should we bring our newborn in, and what does that process look like?
Yeah, I mean, the sooner the better. If you schedule the baby shortly after you're ready to come in, it's always good too. Even it's just good to get a check. Maybe we don't even find anything,
Right.
but one thing you can look for is the baby like super fussy all the time or colicky. A lot of times there's a lot of twisting and pulling that takes place during birth. Like even if it's a natural birth, especially C-section, they're really pulling on that head to get the baby out. So that C1 often at the top of the neck can show up, and that can lead to like issues like fussiness, colicky, reflux, and then difficulty sleeping. And then a big one is when that neck gets turned so much that, or the positioning was a little off, that can cause breastfeeding issues. So that's a big one is, are you struggling to breastfeed? Is it maybe not due to the latch? A lot of times it is, or it's also the baby has trouble turning their head. So checking those things, and we're very gentle with how we adjust. It's just like put pressure on the parents to let us know like how gentle it is.
Yeah.
And babies
So
a lot
gentle.
of times, babies a lot of times will sleep after because they just feel at ease after. And then sometimes they'll even smile after you work on them.
Well, I'll never forget when I brought Brinley for the first time. She was 2 weeks old and she was extremely fussy. She was born via C-section. She had acid reflux, like everything you just said. I'm like, yep. That's exactly what was going on with her. And right away after treatment, she had the biggest blowout. Like she was able to
say that too.
Yeah, she was able to relieve herself on the doctor's table. But then it was the first time, I say the first time, but it was like the first time she took a super deep nap. Like she was so comfortable. She had not slept like that since ever in her life. And so it was just like, just that right there was so reassuring. After that one visit, I was like, wow, she really needed that care. And that was with Dr. Beth, you know.
That's amazing. Awesome job, Dr. Beth.
I know, right? Well, like
but you think about it too.
I'm sorry, go ahead.
One thing too. I think we often just think about things start at the birth process, but it actually starts during, developmental, developing, in the uterus too.
Yep.
Because especially towards the end, the babies are usually stuck in one position. So their head could be like turn to one side for,
Months.
weeks or
Yeah,
months. Yeah.
exactly.
So a lot of times things start before birth too. So we got to think about that.
Absolutely. Yeah. It's such a necessity and it's such a holistic way to treat. I just think for whatever reason, like our parents' generation, there was just all this fear based around chiropractic
Mhm.
care. And now it's such a necessity. And I always say it's like what we should be going to first before we're taking any other steps because it usually can be
Yes.
treated. And it's in
Yes.
such a non-invasive manner. So like I
Yep.
said earlier, you are such a wealth of knowledge. We could be on this podcast for
Yeah.
hours with all of the information that
Yes.
you're able to provide. But I think the beautiful thing that I want our listeners to know is when they come and treat with you, it is a truly, in fact, a experience. It is not an in and
Mhm.
out. You are so comprehensive with the care that you provide. You have so much knowledge as a family unit, and people really can get on this new normal train of feeling good, whether it be during their pregnancy or postpartum. So thank you so much for the
Yes.
work that you do and the continued education that you invest in for your patients. For those that are listening to us today, can you point them in a direction of how they can find you?
Yeah, so you can find us on our website too, www.chirocenterbloomington.com. And then also my Instagram is Dr. Cassie McGuire, DrCassiemcguire. So I often post things on there too, as well. So
All
those are
about
probably the main areas.
Yeah,
Yeah.
and all about holistic care, which I love too. So it's not just
Mhm.
focused on chiropractic care, it's focused on just whole body wellness, holistic care. I will have all of the links below in our notes of this podcast. But Dr. Cassie, thank you so much for being in my life and providing me with tons of knowledge and education. Thanks for being such an incredible resource for our clients. And for those listening today, I know that they have gained huge value listening. And is there anything that you would like to leave them with or any type of fun knowledge about who you are personally or on a professional level?
Well, I just want to say thanks for all your help and everything you provide too, and helping my patients as well and myself. So,
Yes,
very
absolutely.
thankful for that too. I would just say, like, don't wait to do all the things and get checked, especially when it comes to, chiropractic and pelvic floor PT is a big one too. So, I've been doing a little more research too on um, the bladder issues that can happen too.
Yeah.
So, the sacrum, it's so important to keep that balance because those nerves go to the bladder, and then working on the muscles and all that too. So that's one thing I want to leave um, maybe your listeners with too, because that's a really common issue after in that
Yeah.
postpartum phase. So
Yeah,
there's things you can do, and we're here to help.
absolutely. And the great thing too, Dr. Cassie and I work together a lot,
Mhm.
meaning I
Yeah.
send a lot of clients to Dr. Cassie. Dr. Cassie recommends a lot of patients to contact How to Mom. And the beautiful thing there is
Mhm.
we get to really work together then. And so I really feel like it's a huge benefit to my clients and to your patients to know that
Yes.
they have a team of professionals with them holding their
Yes.
hands and helping them through the entire journey.
And always hire a doula because the partner or your spouse, they can't do it all.
Exactly. Nobody can. That's why we deserve
No.
a village.
Yes.
Well, Dr. Cassie, thank you so much for being on today. I am almost certain we will have you back on for many more fun topics to cover and to share with our audience. So thanks again.
Sounds good. Maybe the birth story, right?
Yes, Cole's birth story.
Okay.
I cannot wait.
Yes. All right. We'll talk to you later.
Okay, have a good day. All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.